Hey everyone, Dr. Linda Marquez Goodine here, and today I want to talk a little bit about the hormone game. In the previous video, I did talk about hormones, about one of the hormones. I call it one of the belly fat bullies. So when it comes to hormones, I always say hormones have a personality, and hormones literally are responsible for almost every function in the body. So we just did, I want to say just, but a few days ago we did a 7-day hormone reboot. Next time you need to join us because you're going to learn so much. So I want to talk about the cortisol hormone, which I also call her the stress hormone. I also call her the belly fat bully number 2. I give her a nickname. Her nickname is Courtney. She's like the second queen of the hormone game. And the reason I call her the second queen, the first queen is estrogen. Love her, and you're going to learn about her. But she's the second queen of the hormone game. She shows up when there's an emergency, when there's some stress in the body. So if you want to go back to what hormones are, they're simply chemical messengers in the body that are released by glands, and they will carry functions. They're responsible for a lot of the functions in the body, everything from our sleep, from our weight, to when we wake up, why you wake up in the middle of the night. Do you wake up to urinate in the middle of the night? What about your hair growth? What about belly fat, sex drive, mood? So much, right? So hormones are important. So she comes in, that's why I call her the second queen. She's the one that comes in and kind of saves the day. She pulses. She should not be there present. We don't want her there all the time. Like estrogen, we want her hanging out as long as we are living women. She's super important. However, cortisol, belly fat bully number 2, or I call her the radical hormone, that she should just shows up. She shows up when there are emergencies. She's kind of like this ninja, comes in, takes care of the job, and then she bails. That is what her best job is to do in our bodies. So what exactly does she do? Well, cortisol is made in the adrenal glands. They sit on top of your kidneys, and it should only be pulsed out. And why it's called that stress hormone is because it responds to stress, physical, chemical, emotional stress. I'm looking at what I shared so that it doesn't get so overwhelming. So when you wake up in the morning, your cortisol levels should be high, because she wakes you up so that you get up out of bed and you're good to go for the rest of the day. So she should be high in the morning, and then as time goes on, as the day progresses, she should progressively get low. If you're having issues like, you're having trouble getting up in the morning and you are getting those second winds, like you're like, I'm a night owl, that's usually an issue that your cortisol levels are off. She also impacts how you use carbs, fats, and proteins, impacts your blood pressure. Other things is when you have an injury. If you have an injury, it's like you want to decrease that inflammation. So she pops in. She's like has an anti-inflammatory effect as well. Other things that she does. That I wanted to kind of how she impacts. Okay, well, let's go to what does a cortisol imbalance look like. 1, poor sleep. There's a decrease in your immune system. Women usually get a lot of headaches. Sex drive is lowered. Infertility issues usually decreases your metabolism when she has been showing up too long, because she impacts the thyroid, and the thyroid is the CEO of the body in some ways, and I'm going to get to that to another hormone, but also I call her the fat burning hormone that sets the metabolic rate. And then if cortisol is out of balance, you'll have difficulty with memory. You will have a difficulty with just thinking things through. So just think about a time like when you become really stressed out and you're like, oh my gosh, you can't think. Well, you don't have that executive function of making smart decisions. So that's why you never make a decision when you are angry, when your cortisol levels are like, you don't say things. You don't have those conversations like when you have a car accident, when somebody runs you off the road because you're just gonna vomit stuff that you probably are going to regret saying. Other things, there's that weight gain. That's why women get that belly fat down there. And chronic fatigue, fibromyalgia, what else can I? Digestive issues, so much more, okay? So those are some signs and symptoms of how you know your cortisol is off, is not balanced, okay? The biggest one is that belly fat and the muffin tops. That's very easy to identify. If you are a night owl, that's another thing that you're going to notice, that having trouble waking up, and I stay up late because I have that second wind. Those are really telltale signs that cortisol is off balance. Also, if it's taking longer for you to recover from workouts, you're getting sick all the time. That's immune issues, like pain that just doesn't go away, fibromyalgia. A lot of doctors I don't know what to do for you. So I'm going to give you some strategies how we worked through that. So biggest thing is you got to manage stress. So managing stress is from physical, chemical, emotional stress. So physical is making sure that, you shouldn't extend your workouts and be spending 2 hours a day working out. Keeping your workouts short. I've talked about that in another video. Also, in the mornings, you may want to go out and get some sunlight first thing in the morning. I always put on a hat, no glasses. I just walk outside to set that circadian rhythm. Other things is you got to manage your thoughts, what you're thinking, because if you're thinking stressful thoughts, then you're just going to create stress in your body. Got to manage the sleep, get your sleep dialed in by trying to go to bed at the same time every single day and waking up the same day. Breath work. During breath work, just breathing 1, 2, 3, 1, 2, 3 out, 1, 2, 3 in, 1, 2, 3 out for like 5 minutes and just focusing on your breath. You gotta laugh more. People were too serious. Having healthy relationships. I always have a lot of our patients increase protein intake, have them use branched chain amino acids, making sure they're taking vitamin D. We use a lot of adaptogens also in the practice with especially ashwagandha, which has more of a calming effect. And then we also use shashandra, which has more of a stimulating effect as well. So some other strategies, we even have them take B vitamins as well. What are some other things that I have them do? Well, have them eliminate the sugar, the gluten, the coffee, and the alcohol. So that is a little bit about Courtney, the stress hormone. She's the badass. She's that second queen. But once again, she should just come in, save the day, take off, because she's that ninja that when there's stress, something's not right in the body, she comes in, does her job, and then she bails. That's what she should be doing. So if hormones are off, you can kind of put the 2 and 2 together with what you may have some cortisol issues, which most people do in this time of life because there are more stressors obvious out there, from food, from politics, from relationships, from all the chemicals in our food and so forth, and just the whole hustle grind, and of course all the news, the bad news out there. One more thing. Don't watch the news before you go to bed. Stay away from watching the news. Stay informed, but don't become obsessed. So there you go. Whew, covered a lot. Cover another hormone in the next video. All right, see ya.